and welcome everyone to our webinar series on Humanist Chaplaincy. I'm Anna Popovich, Program Director with Humanist Canada, and as always, I will be moderating today's conversation. This webinar will be 60 minutes in length. Please feel free to submit your questions either with the Q&A tool at the bottom of your screen, anytime throughout the presentation or the conversation, or you can always also raise your hand and I will ask you to unmute yourself. Before introducing our guest speaker, I would like to mention that Humanist Canada has recently launched a chaplaincy program, and you can find more information about that on our website, www.humanistcanada.ca. This is our second webinar on Humanist Chaplaincy. We recorded our first intro webinar with an amazing panel a couple of months ago. You can find that recording on our website as well under programs, webinars. And our topic today is the journey of a humanist chaplain in the UK. And joining us from the UK is Lindsay van Dijk. Lindsay has an MA from the University of Humanistic Studies, Netherlands, and is accredited as a humanist pastoral carer through the UK Board of Healthcare Chaplaincy, the Non-Religious Pastoral Support Network. She provides humanist and existential counselling, coaching, and pastoral care, and is a humanist funeral celebrant at Humanist UK. Lindsay was the first UK-based appointed head of Humanist Chaplaincy, and she is currently the head of chaplaincy at a National Health Service Trust and the chair of the Non-Religious Pastoral Support Network. Lindsay is also pursuing a PhD on the experience of humanist healthcare chaplains entering faith-based NHS chaplaincy teams at Middlesex University. And thank you, Lindsay, so much for joining us from the UK. I know you have a very busy schedule, and welcome. And thank you all for joining us as well.
Thank you very much. We're very glad to be here as well. And it's beautiful how we can connect across different kinds of countries through these digital connections. So thanks for having me today.
Absolutely. So maybe we can begin with you telling us a bit more about your background and your chaplaincy work, why you became interested in being a chaplain, what led you to that decision?
Yes, absolutely. So I guess when I was 18, you got the opportunity in Holland to basically select what kind of studies do you want to do to determine the rest of your life and the profession you want to do forever, which is quite daunting, of course, when you're young and not really realizing what you want to do. But I had a very encouraging philosophical mother and father and upbringing where I constantly was wandering around the world around me and why do we do the things that we do? And I was quite invested in those philosophical thoughts most of the time. So when it came to deciding on the study, I thought at first maybe psychology, but I was a bit adverse to, for instance, particularly giving labels and certain kinds of diagnostics and diagnoses that I would needed to do within the profession. So it wasn't quite right for me. And it was then that I came across a University of Humanistic Studies, which is based in Utrecht in the Netherlands, which is a university solely based within humanist chaplaincy. And that was just everything that I wanted. It was sociology, it was philosophy, it was communication skills, it was world viewing, meaning, purpose, all of that beautiful stuff to actually be trained as a humanist chaplain, which was something I never encountered until I heard about that university. So that's where I followed my bachelor's, felt at home immediately, and also done my master's there, which had a huge part at that time in that master's, about a year or so, that was invested in the practice of how would it look like this theory into practice as a humanist chaplain. And that's how I came across then my journey led to the humanist community at Harvard, which was brilliant because it was a completely different kind of cultural atmosphere as well, to learn about the humanist chaplaincy around Boston, Massachusetts. Working under Greg Epstein, who wrote the book Good Without God, which is a real recommendation. I would definitely recommend reading that one if you haven't come across it already. And that led my path eventually to looking abroad into the UK to see again, how does it work in this social context? So like you were saying, you know, I'm now the head of a large NHS organization, but I slowly kind of worked my way towards that because, and we'll encounter that throughout this kind of hour session, it's quite new still in the UK. It's had its history in Holland for many, many years, but it's quite new in the UK.
Okay, thank you. And what is the history of humanist chaplaincy, including humanist chaplaincy in your country? And by your country, I guess you were born in the Netherlands, but now you live in the UK. So maybe in both, or maybe you have more countries that you consider as your own. So if you can tell us a bit more about that.
Yes, of course. So I apologize in advance. I was saying before we went live, my accent is a bit scrambled. My mother is Dutch. I was born and raised in Holland. My father is American. My partner is Scottish. And somehow everybody thinks I'm Irish with the accent that I've got. So please bear with me. If you can't really hear what I'm saying, just put it in the chat. I'll be happy to clarify as well. But indeed, so how it came to be in Holland was there was some history with regards to the Second World War, where after the Second World War, there was a kind of reconfiguration of the Social Democratic Labour Party that they had at the time, to which a lot of non-religious people belonged to, which was kind of a community sense for them and an alternative to going to church. But that changed after the Second World War, and that just turned out to be a Labour Party, and that whole kind of aspect of the community sense that they had before fell away. So where would they turn to if they didn't have that community as you would have, for instance, in a church setting or in a specific faith community? That was really hard. So there was a man called Jaap van Praag, P-R-A-A-G, who thought there needs to be an alternative for those who do not have that community, that do not have a sense of relation to a higher power or a God, to come together and to actually feel supported by one another, by those like-minded people. So he came up with that Humanist Association in Holland to have that outlet, to have something for those who are non-religious. And that was in the 40s, so just a couple of years after the Second World War. And it was also for him to offer a solution to nihilism, because he felt it was the Second World War that came from nihilism, and that is to believe in nothing at all, of course. And for him, it was important to still believe into something, but you don't have to believe in a higher power of God, but still be good without God and have a moral compass. So that is how the Dutch Humanist Association started. And from there, there were slow progressions as well into routes of what kind of professions would be linked to that. And you had a very early stage of kind of an education training course around social care with humanist underpinnings that morphed eventually into a professional university degree, where I actually studied my bachelor's and master's, to create that equal playing level of having a bachelor's and a master's level trained within this humanist belief system to enter those kind of chaplaincy fields. Because often, of course, it would be requested to have, for instance, a master's in theology or a specifically kind of Christian background that often has those masters. You can see that in the UK as well. But somebody who is non-religious might not follow that course because it's not really akin to their worldview or their way of looking at the world. So this was an alternative to then offer that on that level for them to be able to apply to those jobs. And that's over 75 plus years ago. It's ages, 75 plus years. It's been since the Second World War. It's been around for so many years now that people were able to actually apply on an equal playing field to have that humanist chaplaincy within society. And it's in the armed forces, very much so in Holland, actually. It's in healthcare, it's in the police, it's in education. So it's very well known. So yeah, it was a brilliant footing. And then of course I went to look into other countries, and it's different because I got to see this perfect kind of university and society where it's not really a taboo, it's not something new. And then when I moved to the UK, there were still some struggles, and still to this day, because it's only been there for the last 8 to 9 years. So what they did in the UK, and I came here around 2014, they already did a pilot in Winchester prison to see what the needs were of those who were non-religious with regards to getting pastoral, so emotional, spiritual, existential care of somebody who was like-minded. And they resoundingly said, yes, we would like that service, especially to have somebody of a worldview that was like-minded, rather than, for instance, the priest to come by. Even though they might be well-intentioned and they would listen and give their attention, it was still that perhaps hinder for some people who were non-religious to speak to somebody who didn't share that worldview. And from then onwards, with the connections we had within Humanist UK, that developed. And eventually that developed within over those 8 to 9 years to a professional role being implemented through Humanist UK, where we now have a head that leads that humanist pastoral care development in the UK. And where we actually only had volunteers applying into primarily prison environments as well as healthcare environments, we are now slowly seeing as well that people are getting employed, which is brilliant, because we've got about 14 people or so now within a paid position, which was unthinkable a couple of years ago, especially because vacancies were quite closed. It was very focused on recruiting mostly of a Christian tradition, because that's been the history within the UK. The National Health Service, the NHS, started about 77 years now ago with the vision of including chaplaincy under the premise of Church of England. So that's a Christian basis, of course, and that developed into multi-faith service with Muslim, Sikh, Hindu, Baha'i, for instance, being added to that chaplaincy service. But to ever have, for instance, a belief system that doesn't relate to higher power or God, that's completely a different playing field, of course, and completely new. So they had a lot of transitions that came with it. So it's good to see those developments, that people are now getting that paid employed work.
And following up on that, why is it important to have access to non-religious care within institutions?
I think it is, especially within this day and age, people don't seem to belong to that traditional faith framework anymore. They create their own kind of constructs. We see a lot of people that, for instance, define as spiritual, and they have their own kind of worldviewing, and that might lend itself from different kinds of worldviews and traditions. But for instance, here in the UK, there's a resounding 53% of the population that call themselves non-religious. And that's even higher amongst the 18 to 25-year-olds. That's 71%. So you can see that it's slowly people don't really define within that faith framework, and therefore we need to come with the time and to offer that alternative, to offer the existential spiritual care. I know that's a controversial term for some people to say spiritual, but I mean spiritual in the widest sense of the word, and the existential questions of why me, why here, why now, and to define ourselves in light of what we believe. And as we did our own studies and pilot studies in the UK, those who were non-religious did want that like-minded care. And it's important to offer that in, EDI kind of perspective, equality, diversity, inclusion, to have that on the table rather than to not include that at all. So it's an alternative, but to work alongside those who have a faith, for instance, in chaplaincy teams.
And have you faced any resistance?
Yes.
Can you tell us a bit more about that?
Yeah, so maybe I was a bit naive in the beginning, to be honest, because I had this perfect world in Holland and everything was just normal. And then I came to the UK and I had to kind of defend why I didn't believe in something. And never in Holland did I have to, for instance, say to what kind of faith or belief I belonged. And here I got that question all the time. And especially then working within a chaplaincy environment, people really thought I was an oxymoron. And I still get that basically, as in, how can you be a chaplain if you're non-religious? Why do you work here? Which is actually a fine question to have, because then you can go into a kind of dialogue about what I believe, what that person believes, what kind of similarities we have, what the differences are, but they both come from the same perspective, that we want to help support people on their existential spiritual journey and to do the best we can for them in that caring perspective. But what I was really surprised by was how much media attention it got. First of all, the comments that it came from too, with some people getting really upset and feeling personally attacked that somebody who was non-religious was appointed in chaplaincy, that it was the Antichrist. And I'm laughing because I've worked myself through all of that, but I was so surprised, and it was quite a rough patch to go on and embark on. And I even got a letter sent to me from Texas, USA, to my work and my place of work at that time, with some kind of patchwork kind of lettering saying Jesus died for you, and with a leaflet of how to get to heaven from the USA. So I traveled far and wide, and I was kind of the symbol almost. I felt I was the symbol of what people felt was a personal attack. May it be, for instance, a decline in people belonging to a religious framework, or for instance, that it was the symbol of hope for some indeed, that we do provide an alternative. But it didn't feel like I could just be me as Lindsay. And that was something that I had to fight for within my chaplaincy teams, where they might be really hesitant, specifically those of Christian background, where they felt that I was there to replace them, that I was going to scrap religion altogether, that it was a ploy of the National Health Service to oust religion altogether by hiring somebody who was non-religious. And I had to really battle that by just saying, hey, hi guys, I see that you're worried. Let's just talk about it. My name is Lindsay, and I happen to indeed have a belief system that's humanist, but I'm not just humanist antichrist. I am a person behind it. I would love to get to know you. So it took quite some time to get there, but I think we are there now. Yeah.
Who reaches out to you for support, usually?
So we've got different kinds of people that reach out in chaplaincy overall, but with regards to the humanist side of it, funnily enough, it's not just, of course, that we provide for those who are non-religious or agnostic or freethinker or humanist of some sorts, or non-religious overall. We are there to provide an inclusive chaplaincy service. So I will see people as well from different faith backgrounds if they're happy for me to visit. And similarly, for instance, those that might be non-religious patients or relatives or staff members, they might want to have as well as to chat with somebody who's of a different faith background. So we're there for the specifics if somebody wants that like-minded care, but we also care for anybody regardless of if they're happy to. So I, for instance, seem to get a lot of requests from, well, people that are non-religious, obviously, but also those that might feel fearful within their own faith tradition to go to their own minister of faith because of feeling judged, for instance, or that they might have done something wrong and they've been sinning in that sense. And although, for instance, a minister of faith or a priest would be very accepting, I would think, within my team towards that situation, they might not think so, that they would be. So I could be perceived as neutral because I don't have that allegiance to that particular faith that they may come from. So they might feel safe to entrust me with that. And then what I can do is to also liaise, of course, and to see if there's anything I can do for them to feel connected to their own faith community, if that's what they want. So it's almost trying to facilitate that conversation if that's where they're at. And similarly as well, for instance, that I've got referrals of those who are of the LGBTQ plus group, because they might see somebody who's humanist to be more open and inclusive than somebody who would be of a faith tradition. Again, those are all perceptions, but those perceptions seems to sometimes have a barrier from those kind of perspectives to access chaplains who have a faith background. As well as with suiciding, so end of life and taking your own life, that they feel comfortable in talking to me about it because they don't feel that I might have that assumption that it's wrong, as for instance, they might think would be if you were to be Catholic, for instance, or Muslim. So yeah, it's quite specific, but it's really interesting to actually have those conversations. Have you worked in prisons? No, I have not, no. But we do have people who work in prison, yes.
And so what are your, I guess, main areas of focus or, main groups you work with?
So for me, that is in healthcare primarily. So mental health you might have, but mostly acute health where I work at the present. So you got people that might be in and out of hospitals, so you only see them once. And that's sometimes hard, of course, in how you build that relationship, because all you can do is what you do in the moment. This is very much in the moment kind of role that you have within humanist chaplaincy. But you also have those that might be spinal patients. So they might be there years and years. And I know one that was, for instance, for 4 years long within that area, the spinal ward. So you get to know them really, really well. So yeah, healthcare is primarily my kind of area of expertise. And I worked with some younger children before as well in education, which is different kinds of topics that you discuss about growing up basically and choices and who are you, identity, and all of those kind of topics, which was brilliant.
What does your day look like, if I may ask?
It's waking up, needing a lot of coffee. I work full time, so I'm the head of service within chaplaincy. So there is managerial responsibilities with just running a service, trying to promote it, and day-to-day kind of meetings to liaise and kind of talk to stakeholders, etc. But for me, it's very important that I also have my clinical work. So clinical work, I would say, is, for instance, patient interactions or relatives, etc., staff members, particularly during COVID, they would need a lot of support. So it's the visit and go into the wards. And in this day and age, it's putting on your scrubs because you need your face mask, you need your kind of plastic apron, you need your gloves before you go into any kind of patient interaction. And you might need a bit more if somebody is positive with COVID. But for me, what I really love about the day, especially when I'm seeing patients, is that you never quite know what kind of situation you might find yourself in, because we don't get a brief beforehand that you might get as a psychologist with why they might want to talk to you or the issues that they're facing or an outcome that they prefer to see. It's just literally, my name is Lindsay, what's your name? And then anything else can come out of that. And you just have to respond in the moment.
What have been some of the most or more challenging experiences you've had?
Within conversations or overall within the chaplaincy team?
Overall, something, yeah, you might want to share as a challenge you've overcome in your work or a difficult situation.
Yeah, so I think it's mostly been working within multi-belief teams. You can say multi-faith and belief teams, but belief relates to the higher power or not. So working within multi-belief teams. So I've had no difficulties at all with service users that might find it odd that I'm a humanist or non-religious within chaplaincy. And that could be patients, staff, relatives. But I have had controversies within my own team and people that were trying to get rid of me because of my belief system. And of course they couldn't anyway, but it just gave a lot of headache and challenges with regards to that. And I remember at my very first position at another trust where I was lead chaplain, I remember that one of my managers at that time said, Lindsay, just get it out of the way. Of course, they're nervous. You're the first one ever. Just tell them a bit about humanism. They'll be fine. You know, just stand up, lead a session and just explain that to them. And I thought, okay, I get what she's saying, but what I don't want is the focus to be on me again and for it to be kind of a shooting game as in, why do you believe that? So what I did instead was to make it about us as a team. So I invited every member of staff to talk about their own faith and belief, may it be Christian, Muslim, Baha'i, interfaith, as well as me sharing about my humanist belief. And I went very last. And in that sense, everybody was connected to, why do I actually believe the way I do? And what does that mean to me? And why is that special to me? And how do I practice that within my chaplaincy role? And for people to ask questions about that. And then simultaneously with myself, so we were all vulnerable. And I remember that was a real turning point that day from lots of challenges in the team with me coming on board. It was where the nun said, the Catholic nun on my team, she said, you know what I really learned from today is that we've got so much in common. We all got love for what we do and passion for the people we see. And that's something that really stuck with me. And from that moment onwards, we just worked so much better through open communication. And that's something that I've always promoted.
Thank you for sharing this more intimate aspect of your work and life. What kind of training do you receive as a humanist chaplain?
So in the UK, we've now got a master's course. So that's quite new. That's only been there for the last 3 years. So when you apply to a job here, you need to at least have an equivalent background. So that's better than theology that they had before, because it was very exclusive in how to recruit, of course, because if you're not religious, you probably won't have a theology course. But you can now, for instance, have a psychology or a communications course that's kind of translatable to the skills you might demonstrate within the chaplaincy field. But what you always need to have is at least your endorsement or accreditation of your faith and belief network. So as a humanist, you would be accredited by Humanists UK. Now we set something up, a board on the Humanist UK called the Non-Religious Pastoral Support Network. And I'm also the chair of that. And through that board, we accredit future humanist chaplains. We call them pastoral carers in the UK because the terminology seems to work better for those who are non-religious rather than chaplain. But I refer to chaplain because I know that's easier as well within the context of how you use that within Canada. I know it's used in the States as well. So what they do is they have to at least be 1 year members of Humanist UK, and then they can apply to a course which they don't have to pay for because they're already linked to Humanist UK. Which is a weekend training to get their accreditation, but we screen them beforehand as well with regards to what are their motivations, what are their aspirations. They do self-statements and kind of almost treat it as a job description where they have to send in their information for us to interview them. And then they have to do some coursework throughout and afterwards as well. And they'll be assessed throughout that course. So some of them, for instance, might turn out to not be suitable for chaplaincy field through the trainers that have assessed them, or they discover themselves that they might not be suitable for that as well. Because what we really look for is people that are able to work with people of other faiths and beliefs, because that's what you do. You work within a multi-belief environment and you will come across people that don't share your worldview, and having to be able to be strong enough in your own worldview to not want to proselytize in a way, to basically prove your own right in your own worldview. And if that all goes well, then they can apply for any kind of paid position. We now got, for the last 3 years, also a master's course in Humanist and Existential Pastoral Care at the New School of Psychotherapy and Counselling. And they're linked to Middlesex University. And it's a 2-year-long master's program that specifically relates to humanist chaplaincy. So that was a real turnaround for us in the UK, because again, you can see the history with Holland, can't you? It's kind of a simultaneous footing where they can now have an equal pathway into those paid roles with an alternative master's course to theology. So it's great to see that kind of history kind of tallying up as well here in the United Kingdom.
Is this the same program as your MA in Humanist Studies, or that's a different program?
So
the one you just mentioned.
So the one I just mentioned this in the UK, and the one that I did was in Holland, of course, that has a bit of different modules in that sense. But yes, no, the master's is the same here in the UK. Yeah.
Okay. And would you mind telling us a bit more about your doctoral studies? The focus of your dissertation, I know it's closely related to the work that you were doing. And before the call, you mentioned that it is a pioneering research project.
Yes, because we haven't done much research here in the UK yet, of course, so it's so new. So we haven't published loads around what humanist chaplaincy means in our UK context. We've got one book by David Savage, which is great. That was a real turnaround about 2-3 years ago, I think, that it came out. And that's great, but there's not a lot of articles that relate specifically around the humanists and their experience of joining healthcare chaplaincy teams that have been so established and always particularly Christian or faith-based. So I thought, I've experienced a lot, also being kind of an insider researcher in that sense, of course. I think we need to have some sort of research around the experiences of humanists. So I've now started about 1.5 years ago, then a PhD. I'm hopefully halfway. I say hopefully because, you never know what happens within research. It can be longer, hopefully not. But around the experience of humanist chaplains entering traditionally faith-based chaplaincy teams in healthcare. And I'm using thematic analysis. So basically, I'm doing surveys, open and closed questions, as well as interviews with humanist chaplains to ask about how they experience being part of multi-belief teams. And some of them have really difficult times by being included in their teams, for instance. And some themes might come up around loneliness or not feeling supported, for instance, whereas others felt very welcomed. So it seemed to be quite different themes that have emerged based on the characters of the chaplains they encounter and how strong that chaplaincy team might be, feeling supported as well within the hierarchy of their own institution. I've also asked actually those that are faith-based in the survey question, again, open and closed questions around their experiences of having those that are non-religious coming now into their team. And it's really interesting to see already some kind of preliminary research, so I can't really say much yet about it, but preliminary themes come through about both who are non-religious as well as faith-based and their struggles, as well as their similarities. So for instance, one example, if that might be helpful, is where those that are faith-based say, we can do all of it. We are kind of the carnivores. No, we are the omnivores amongst the vegetarians. So we do everything. Whereas, for instance, those who are humanists can only eat the greens, you are vegetarians. And we can provide prayer, and therefore we can do everything at all. And then the humanists say, we can be more neutral because we're not biased. We don't have any doctrines. We have no dogmas. We don't have any affiliations. So we can listen better. We're more person-centered because of the absence of that doctrine, religion, prayer, rites, and rituals. And there are a lot of differences being mentioned. But then when I ask them about a case study and how they respond to that particular case and how they would respond pastorally, spiritually, religiously, the whole religious care seemed to be pushed aside. And they all seem to respond very similarly, which is just to listen to the existential and spiritual concerns of that person rather than doing things. So it's only when somebody requests, for instance, prayer, that they would respond by or referring onwards to somebody of their faith and belief group, or by potentially delivering it. But it's not in the foreground at all. It's mostly that emotional, spiritual support. So I find that very interesting to see that preliminary outcome already. We have more in common than we think. So to stop basically bickering amongst each other.
Mm-hmm. And so from your perspective, what is the difference between secular helping professions such as psychotherapy and humanist chaplaincy?
So
which I think is a common question that a lot of people are confused about.
Yes, and I often get the question as well, why don't you just go be a counselor because you've got humanistic underpinnings? And we often refer to Carl Rogers, of course, as well, with the person-centered approach, which is officially rooted within psychology. But what I always really loved was a professor. He's unfortunately no longer with us. He passed away about a year ago, but his name was Jan Moren. And he was a professor at my university in Holland. And he wrote a very small book that was very influential around the difference between humanist pastoral care and psychotherapy. And he said, you know, the differences, because we keep on being asked these questions, the main differences are two frames of references, he says. And within psychotherapeutic traditions, the first frame of reference is the method. As in, how do you engage in a conversation? How do you utilize, for instance, questions or giving feedback or a direction that you take within the conversation? And then secondly, the frame of reference might include somebody's values or worldview, but it's not really on the foreground. It's mostly that methods, may be integrative, CBT, for instance, psychoanalytic, yada, yada. But when you look at humanist pastoral care or humanist chaplaincy, he says that first frame of reference is the worldview of that person. It's the values. It's the lens through how you see the world. It's your morals, what makes you you and forms your identity. And then secondly is the method, as in how you, for instance, question, provide feedback, listen, etc. But that worldview is the most important one. So he flips it around. And I think that's something that really felt and hit home for me. That's why I am within a chaplaincy service, because it's about worldviewing. So it doesn't matter that it's non-religious, because worldviewing is within a humanist tradition still a belief system. And it's all around meaning making and purpose. So that's just a little bit that always stuck with me from Jan Moren.
And how do you work with the non-chaplaincy helping professions, social workers, counselors?
Very closely, because it's often referring to each other. So it's a skill to recognize when you're crossing over. And I'm also a counselor because that came with my master's as well, that I can be a humanistic counselor. So you need to be very careful, of course, that you don't cross your boundaries within chaplaincy. And I guess that's the difference. Within chaplaincy, you stay in the moment. You can only do what you can at that moment in time, because you never know what might come after if you see them again. But what we're not there to do is make particular kind of advancements for a better outcome. So within kind of psychotherapeutic traditions, you have, for instance, that past, present, and future that you link together to get to a better understanding and outcome. Whereas we don't tend to do that within chaplaincy. So when we start trying to analyze and try to solve things, or trying to, for instance, steer towards a direction of improvement or betterment, maybe that's beyond ourselves. Maybe that's something where we need to refer more to psychotherapeutic services as for them to pick up, or social care for particular solutions that need to be made for them to feel safe at home, or to have certain kind of aspects when they go, you know, being released from hospital, make sure that they still got that care when they return to their houses or their home environment. But it's to recognize that. But we work very closely, and simultaneously they refer back to us as well.
Mm-hmm. Okay. And how does your role of officiant or celebrant, I guess in the UK, compare and contrast with your role as a chaplain?
I think they really supplement each other. So I see the celebrancy side of it as kind of the rites and rituals that we have within the non-religious tradition. So for instance, a baby naming service, when we have losses, baby loss, for instance, in hospital, where you can do a baby naming to mark that moment in time. So it's to mark transitions and occasions that are important in a human's life. And if you were to look, for instance, at chaplaincy in the UK, they define it in 3 different ways: pastoral, spiritual, and religious care. And I know religious care often sounds like it's Christian oriented with prayers, etc. But actually I see it as rites and rituals and marking moments. And that would be something that we would do too under that non-religious traditions with celebrancy. Funerals, for instance, again, marking that life that has been and the memories that have still been kept in hearts of those that they loved, as well as, for instance, weddings, which is a tricky one because they're not yet legalized in England, but they are in Scotland, in the UK. So we need a registrar still to make it official in England, but they are on the case at the present to make it legal to marry within humanist tradition. And hopefully that will work out soon. But again, it's the transition. So it supplements the humanist chaplaincy side of it, where you can make personalized traditions too. So often when, for instance, I have colleagues that want to understand, well, how do you do certain things? Where's your book as a humanist? It's very hard to explain because we don't have a book. We very much respond to the human nature of the person that we have in front of us. And that's also thinking of on your toes, for instance, when you are at a ward and somebody might be passing away or has just recently passed away, for instance, and the family's there and they want to mark the occasion at that time, is to find a ritual that makes sense to them, that they might have had as something that's of key importance in their family kind of constructed lives. And to make that, to make that personal into a ritual. So yeah, I really love it though. It keeps you creative, I guess, too.
Mm-hmm. We have a question in the Q&A. In practical terms, how does a humanist chaplain respond to individuals who request prayer, especially if there are no theist chaplains available?
Yes. So we often get that question because for us, the hard line in the UK is you don't lead into worship. So you can't lead on the prayer. What you can do, and that's up to your own boundaries, I would say, is in how you feel comfortable with regards to that interaction, is, for instance, to read out a prayer and to be very clear that you're reading out this prayer on behalf of that person, but you're not leading into worship. Or, for instance, that you were to read out specific texts that might be beneficial to that particular person, or to refer onwards, of course, to other chaplains in your team. Now, if you're the only one who, for instance, be present at that time and there's nobody else who can come by, it's just to explain about what you can and can't do. And it's not leading into worship, but you can request, for instance, for them to lead into prayer, you being alongside them and be in the room. Or what I've done in the past was to narrate their kind of prayer with their God while sitting next to them. So for me to ask, well, if I weren't sitting next to you, but it was God, what would you like to say to him? So you're in a conversation with them about it, but again, not leading into worship.
Okay, so let's invite some more questions from our listeners. Please feel free to raise your hand. I believe that should be at the bottom of your screen. I'll ask you to unmute yourself. Just a reminder that this webinar is being recorded. You can close your camera if you wish so. You can also put your question in the Q&A box. Question from Marty. Did you attend the Chaplaincy Institute's meetings in 2015? Will that occur again?
So did I attend
the Chaplaincy Institute's meetings in 2015?
I don't think I did. No, I was just about a year into being in the UK, but it sounds really interesting. Was that, I'm guessing, to discuss chaplaincy in an international kind of forum, Martin?
Martin, would you like to expand on that? Yeah, there you go.
Yeah, hi, Lindsay. Yeah, I'm involved in the training program here in Canada with our Humanist Chaplaincy Board. It's great to have you with us today. Yeah, the question is, there was a group that gathered in the Netherlands in 2015, and they had 30 chaplains from all over Europe. And then they did a poll and a survey, probably not too asking some similar questions like you did, what you're working on in your doctorate. And I thought that the results that came out, it was published in a study that came out, I think in 2018, that I ran across, and they are working with some of the issues that you are. And I just thought it was such a great survey. I think they got 17 or 18 of their group to contribute. to it. And some of the key questions they asked were, what is humanism and what is the unique thing we have to offer and what are our challenges and what is kind of our central way of offering this service? And they all answered that. And it was very interesting because they parallel some of the comments that you have in your experience in the U of K in UK in terms of the National Health Service. And I would really like to see that extended to North America, where we could attend something like that and put together a chaplaincy kind of conference. And I just wondered whether you knew whether that 2015 conference was going to reoccur again, because it's been 5 years.
Yeah, I think I know what you're referring to now. That was actually at my university where I studied that they've organized that, because I remember my British colleagues telling me when I moved here that they attended that and they were really impressed. I'm not sure if they're going to organize it again. I think they should. We're in close contact with them, and it would be a great idea to actually start, how do you say that? Maybe revisit those statements that we had about, 7 years now ago, if it was 2015, what's still current, what has developed, and how can we help support? Yes. Because it's still in flux.
A take on that, I'd be interested, because I'm interested in some of the administrative and things that we can do to pull chaplains together and unite our experiences. So the board that you are the chair of, this Humanist Chaplaincy board in the UK, how do you meet? How do you exchange information? What's your schedule of interacting with each other? Because we'd like to do something like that here with our Humanist chaplains.
Of course. So the board is advisory, so they don't make decisions. That's up to the head who oversees all of that humanist chaplaincy side, of course. But we're advisory, and we talk about, for instance, how do we deal with complaints issues? What kind of handbook should we have to help guide those that are newly accredited? How do we revise training courses? What kind of training courses are missing? And we meet around 4 times a year. If more required, we meet more. But it's all voluntary based. So those that are interested, for instance, in joining the board, they've been asked to do so in voluntary capacity, but they often have some kind of background, for instance, in a certain area. So we're now looking in, for instance, to potentially further down the line, recruit somebody in the MOD, because we're still talking and negotiating about humanists entering the MOD here. So the Ministry of Defense. And hopefully we'll see that development soon. So if you've got those different areas of where you want to establish yourself within humanist chaplaincy covered in your board, then you can feed in those experiences and backgrounds to then have that advice for that person in charge of humanist pastoral care in the UK. So yeah, more than happy, to talk more about how that is. We can help support you as well setting that up. I know they do it differently in Holland. We're looking into how we can potentially reform it in the future as well in the UK. But I remember that in Holland, for instance, they've got with the Dutch association there that if you were to go through your master's there, it doesn't mean you're already accredited. You would need to then present yourself to the board there, and they will go into a conversation to check whether or not you are well-rounded within your humanist view and tradition and what humanism means to you and how you are going to be their representative. That's how they see it. They send you, in a sense, to an institution where you represent them if they give you that accrediting status. So some people get rejected in the sense that they don't get accredited after they've done their master's course, for instance, under the banner of Humanist Chaplain through that Humanist Dutch Association. But there's an alternative, though. There's kind of a neutral spiritual guidance counselor board where anybody, regardless of faith and belief, can fall under and be accredited through. So it doesn't mean you can never then practice as a pastoral carer, but you might not be seen as a humanist pastoral carer as such. So that's a bit of a different construction.
That's a different differentiation. That's a very subtle one. And I'm very interested in also, we have the same issue you had in England with trying to develop an alternative to the theology education. We're looking for those alternatives. And the program you talked about, was it Middlesex? Is that right?
Yeah, so they're linked. The New School of Psychotherapy and Counselling are indeed a daughter University of Middlesex University. Yeah. Okay,
I'll look that up. I'll Google that. Thank you.
Thanks, Martin. And I think what we mentioned as well before this went live, and I just want to reiterate that, it would be great to work together in that sense. If we're both pursuing that kind of route and we've got something already in the start blocks, then maybe we can kind of join forces to see what else we can set up together and make sure that we can support each other in that route.
Well, we will follow up for sure with you, Lindsay.
Brilliant.
Okay, thanks, Martin. So another question, since humanism does not have a symbol to wear around the neck or a book to hold, do you find dressing a certain way helps people identify you as a chaplain?
I
or is
think
there some kind of a dressing code?
I think that is still a very difficult challenge that we're facing at the moment. Part of my research is as well the difficulties around dress and language, by the way, too. But dress is one of them. So we don't specifically, other than infection control, bare below the elbows, for instance, within healthcare, have anything that they have to wear. So some trusts may say you have a uniform, but they would not, for instance, say to those ministers of faith that they can't wear their colors, because that's their own expression, of course, as part of their faith tradition, but therefore they're quite visible with what they represent. And it's easier, for instance, to see that they might be within the chaplaincy team. If you're non-religious, you don't really have a uniform, because we're not uniform in a sense that we have prescriptive ways of how we present ourselves out in society. It's a plus as well as a downfall, because, for instance, I've encountered a lot of times when I go onto the wards that people all of a sudden start sharing their wounds with me because they think I'm a junior doctor or somebody giving me scrubs to do my assessment, which I'm absolutely not equipped in. And I immediately have to say I'm nothing clinical. I'm here on behalf of spiritual and pastoral care. I'm a non-religious chaplain. So that has its downfalls. What would be helpful is actually, and that's what I'm trying to do as well within my own team, is to have the discussion, do we want to wear something as a t-shirt by identifying pastoral spiritual care, or have something on your badge that identifies your worldview, for instance, humanist pastoral care, humanist chaplain, etc., to help support each other in identifying yourself, especially when you're non-religious and you don't have that wardrobe, but still something that's quite controversial and challenging.
Other questions? And I see we have a couple of officiants, Humanist Canada officiants on the call, as well as I would like to acknowledge Srishti, who's on the call and who's has been playing a leading role in launching our own chaplaincy program. So feel free to jump in if you have any questions or comments. Martin.
Hi, Lindsay. It's Martin, the other Martin, and
hi, other Martin.
And I enjoyed our talk earlier. One of the things, just on the on that question about how on deportment or dress, and I know one of the things that we're looking at is certainly in the armed forces is that there would be like a lapel pin or that'll have the happy human on it. So it's minor and discreet. Maybe we just need to make it larger and hang it around our neck. That's but that's an aside and a bit tongue-in-cheek. However, I did want to ask you, given you've talked a lot about what this journey has been to chaplaincy to date, and I was curious, where do you see humanist chaplaincy, certainly in the UK, in 5 years or 10 years down the road, as a vision? And coupled with that, I'm curious as to what do you see as the major challenge, in that journey?
Yeah. So
thank you.
That's a really interesting question. What I'm actually currently trying to do, because we were talking earlier about CPE, clinical pastoral education, which is quite known, of course, as well in the States, in Ireland and in Canada. We don't have that yet in England. So we're trying to take that across, the pond and to be able to implement that here in the UK. And that's something that I'm piloting this year with support of Ireland and a CPE accredited person there who's flying over in April. And that will be a couple of years journey to try and see that change and to professionalize in that sense too, with including that non-religious view too. So they're very excited about how do we need to change it, also with regards to language, to make it inclusive of any kind of faith and belief. But on top of that, I'm trying to set up an apprenticeship as well, which is linked to innate skills, regardless of faith and belief, again, of what a chaplain should present itself as. Doesn't matter if you're in prison, MOD, education, or healthcare, but to actually fulfill that with an institution who can do kind of the assessments as such, that you are on that level of apprenticeship, to get people in a different way. Because what we are getting now is, of course, masters are great, but they're also costly. And in Holland, you know, I had very low fees because Holland's educational fees are quite low for Dutch students, which was very good for me. But here, for instance, our masters in the UK, although great, is still £8,000 to £9,000. And there's no guarantee of a job afterwards, because of course it is quite a challenging field to get into, especially if you're humanist and we're just coming around the corner. So often employees don't, for instance, fulfill those fees. So apprenticeships are quite easy to then set up, because you can do it for any kind of faith and belief to equalize the entry pathway as well for chaplains coming in. So it's not just Christian orientated, and they can then grow into the institution that they work for as well on that kind of pay scale level, and do traditional kind of training within that institution as well for further education. So that's something that I see hopefully changing in the next 10 years. So for our kind of side of things within the humanist tradition and equalizing it, but also for those other minority faiths, because they're also still struggling with getting paid jobs, if you're not particularly of a Christian denomination. So hopefully that will change. But also I think for me, in the wider context of it, and that's why I love talking to you today, is how can we link more up internationally? Because I know we've got Humanist International, and that's brilliant, but I love to see something international as well with regards to Humanist Chaplaincy, its developments, how we can support each other resources wise, and you know, to have something more in that sense.
Okay, well, thank you very much. Actually, I really appreciate. I'm more optimistic. Not that I wasn't, but that's we're well on the road then.
Absolutely. Just keep going one step in front of the other.
And thanks, Lindsay.
Thanks, Martin. Ian. Oops.
Thank you. So first of all, thanks, Lindsay. You speak about chaplaincy with such exciting tone that it makes me really excited about it. I guess my main question is, for a young-ish person who's considering chaplaincy, what is your advice for someone who's considering it? And I'm thinking like either that's general life advice or specific things to read, kind of any sort of wisdom you can offer.
Absolutely, and that sounds brilliant, Ian, as well. I hope you know that you demonstrate that passion as well, and that you pursue the path if that's something that you feel you want to walk down on. But I was quite young myself, you know, choosing at 18 this course in Holland because it was there. Was for me all around meaning and purpose. So definitely immerse yourself in kind of literature and books. Good Without God, that book of Greg Epstein, I would definitely recommend. There's some articles out there that are open access by Carmen Schumann, SCHUHMANN, who is a professor at my alma mater, and they've published a lot of articles, as well as the book by David Savage. That will be kind of a good immersion in literature. But actually, I'm more a practice kind of gal. So what I would say to get really interested and immerse yourself in the experience would be to see if you can volunteer at a nearby institution, may it be, for instance, a hospice or a hospital or anywhere else, a school, for instance, that might have those pastoral roles, just to get yourself acquainted with it, and to also feel how it is to work within a multi-belief team, because you can learn a lot from colleagues that are already years in that profession. So it sounds really exciting. You're at the start of something great, Ian. If there's anything that you ever want to ask, more than happy for you to email. Always great to see somebody's journey.
Well, Lindsay, thank you so much for being here. Can you speak a little bit about diversity, equity, and inclusion with regards to chaplaincy? What do you see as the role of chaplaincy in social justice?
I think it's huge, actually, social justice for a humanist perspective. We are there, of course, we underscore the Universal Declaration of Human Rights. So to give you an example, for instance, I'm here, of course, representing that non-religious worldview, and talked about how it should be equitable for those who are non-religious to have access to healthcare chaplaincy provision that have that like-minded non-religious chaplain on board. But simultaneously, now as a head of service, I also have to, of course, be how do you say that, represented that equality and diversity within my own team, and to stand up for the rights of those that have different belief systems. And there was one particular instance, for instance, where Christians in my team, which you would think wouldn't feel that way because it's usually the Christians that are very much supported in society, but now because there's less and less people belonging to that particular faith tradition, they're struggling a bit, where actually they felt they didn't have a voice in my previous organization, and therefore I had to kind of vow for them. I can't be too specific because it's something that is something I don't want to fully disclose, but because I was non-religious, I could actually stand up for their viewpoints that they wanted a specific service with regards to their Christian identity, and for them to be able to express that Christian identity as well. And they were so surprised that I did that, because originally they thought, for instance, because I'm non-religious, I might not see the benefit of it. But what I see as a human is that everybody has the entitlement to express their faith and belief, and to see that as an importance, and doesn't matter what kind of faith and belief you are. So with regards to equality and diversity within a faith or belief perspective, that's what I'm doing within chaplaincy. But wider than that, it's LGBTQ+, for instance, it's the ability and disability kind of networks as well. It's BAME, for instance, as well. So I always have had a role in the equality, diversity, inclusion committees at any institution I've been part of, and trying to fend for that as much as I can. So yeah, as a humanist, definitely, we have a big role to fulfill in social justice and EDI perspectives.
Martin.
Yeah, Lindsay, would like to add to what you said for Ian McMillan, who reached out wanting to learn about chaplaincy, is that, Ian, you need to connect with the chaplaincy committee here in Canada. And one of the ways that you can do that is just to email us, and we can get in touch with you and give you some suggestions. And the other thing is, just to start out, is that we have an excellent resource online, and it's called the Chaplaincy Innovation Lab, CIL, and it's at Brandeis University in the States. But we have humanist chaplains that are in their fold, and they have us speak at their various webinars. So they have an ebook that you can get for free on becoming a chaplain. And it's a very introductory one. So I certainly recommend that for you, Ian, and anybody else listening that has an interest in learning the basic fundamentals.
Brilliant. Thanks, Martin. That's really important indeed to link back to Humanist Canada. Yeah.
Thanks, Martin. We have a couple of more minutes for a last question or comment. I think you should be able to speak now.
Let us waste any time with Lindsay. It's so great to have her here. I'd like to be right in the room with you, having coffee and picking your brain. One of the things that I'm very curious about, because we've had the same issues here in Canada, although we're not in hospitals, our chaplains are all in higher education. And we have 4 that are in that context. And that is how to develop some kind of respect within our group. And you talked about that that's not always easy, and it's not always, for some, in their experience, it's not always very welcoming. And I'd be interested in knowing, when you talk to other chaplains that are non-religious, there often are key events that happen in your role and in your job in relating to the other chaplains that begin to turn their view that maybe a humanist chaplain's not a jerk and an antichrist, and that we're not amoral, and that we eat our children for breakfast. They actually have an experience with you. And I've had several of those in universities that change people's minds. And one of them is when I supported a young Asian Korean Christian boy and helped him find resources as a Christian. And when the other chaplains found out that I was not trying to proselytize him, I wanted him to deepen and connect in his own community. My kind of reputation really changed in the group. Do you have any stories like that that you can relate that really began to change people's view of a non-religious chaplain?
Absolutely. So from my own experiences, but also those that I've heard from my non-religious colleagues, was that they were happy to have difficult conversations and not see it personally. So you'll get conversations that are uncomfortable. Why are you here? Or do you believe in the ultimate truth, is what I got, for instance. I don't know what the ultimate truth would be for me, but interested to hear about that. I think if you come from a stance of, that's interesting, and trying to understand where somebody's coming from without seeing it personal, but that it's something of them that they're trying to work through, then you're almost pastoral caring for that person at that moment in time. What I've seen where it doesn't go right is where, for instance, even with my research of the answers that I've seen, but also conversations I've had with those that were faith-based, is where people come in blazing as an, I have the right because I am non-religious and you don't provide for me within my faith tradition, and you have to change the name, and you have to, for instance, change your wardrobe, from what we were talking about before. So it's trying to change from the start what they've done for years, which is very threatening, isn't it? They've worked well throughout all those years, then they open the doors to somebody new and completely different perspectives. That takes time. And I guess, that's also with the question that I see in the chat, for instance, intersectionality, is about where do we overlap? And that's key, isn't it? We overlap in our humanity, that we might all be fearful and scared of change, but also in, for instance, recognizing that we can't do without each other. We have to work within that multi-belief team. And also with regards to, for instance, that we have a lot in common value-based wise. So when we were talking about, for instance, the prayer, for instance, where you can't lead into worship, I've read a lot of the times Corinthians 13 for people that might find comfort in that within their Christian tradition. And for me, that's just the ultimate value of love. And that is a big value for me. And that's just a human value for me. So I can relate to that. So I guess it's about how open you are in having those conversations, and to not take it that personal, just trying to understand it's been a long established network and people might be fearful. But when you start just showing yourself as individual rather than you are a label of, then that really seems to help.
Great advice. Great story.
All right. Thank you so much, Lindsay, once again for your time and for the rich insights and your overseas perspective. I'm sure the conversation will be continued at the organizational level. And thank you all for joining us, for your questions, for your participation. Stay tuned for our further announcements about our next chaplaincy webinar through our website, social media channels, or you can also sign up for the webinars only sign up list, and you can find that on our website. And thanks again. Have a wonderful rest of your day. Thanks, Lindsay.
Thanks, Anna. Thanks, everyone. Bye-bye.
Bye.